You said you lost your fertility. So you have achieved menopause, or what's that?
So I was 32 when I was sick. I was
Yeah.
struggling with fevers. Us time pe I didn't realize much, and all of a sudden, when I got the diagnosis, I felt that I was not having my periods, and I talked to my doctor, and I was like, "What has happened?" He's like, "I'm sorry, but you were so sick since last 3 months, and then we got your diagnosis. We had to start the treatment. We didn't had much time to talk
Yeah.
about it, and then they actually sent me to a fertility specialist after 2 months." And she said, "I'm sorry, Harjeet, but your ovaries are not working. And because you already had aggressive chemotherapy treatment, it was a
Yeah.
red devil treatment, which I had, which is very
Oh.
aggressive and painful. And she said, now you're going for a stem cell transplant, which is more aggressive. So there's no way that, we can preserve your egg or do anything about it. You have been, thrown into early menopause at that age. And when she told me the news, and I felt like I wish I had time. I wish I had time to
Yeah.
preserve my eggs or do something about it. And I had a little, argument with my husband that why you didn't talk to me about it and why you never discussed this thing before getting me treated. It's like our first priority was always you. And I had
Obviously.
no, idea of thinking beyond this. So
Mm.
yeah, I still feel that grief every time, but that is what it is, right?
Yeah.
But I had no idea that, our mothers have gone to menopause at the age of 50 plus or 55 plus. But now I feel the struggle they go through it. You have this anxiety all the time, stress all the time, hot flashes all the time, So
Yeah.
these things are really crazy.
And you
And
were going through all this while you were going
yeah,
through
yeah. And
your
at that
cancer
time when I was
treatment.
going through this, and now I feel more that, because I'll be turning 40 in another 2 years, and
Yeah.
I'm already into early menopause. There are so many side effects of it I'm dealing
Yeah.
with. And we don't talk about early menopause.
No,
There's,
nobody. Yeah.
I know the word called perimenopause, which
Yes.
is over there. I don't know where, but I've been to seminars and events where they talk about early menopause. And I know how, this looks like. So I think that's also one thing which we need to talk, because I think the whole thing which is changing our lifestyle and stuff, people are going through early menopause at certain age now. What was supposed to be 55, 60, now people are getting it early,
Early,
right?
yeah. I think because of lifestyle,
Yeah.
because of food,
Yeah, everything,
and
like all the global
pollution,
thing,
global
globally bad.
things
Yeah,
happening.
yeah,
Yeah.
thing.
I think if a woman goes through cancer, I think what first thing comes to your mind?
For women or men,
Yeah,
both.
for women, I feel.
For women, I think if you go through cancer, I would just say, please don't lose hope and ask for help. If not your family, friend, maybe a doctor, just don't go through this journey all by yourself. It's not easy.
Yeah.
And to all the people around you, like, if you feel someone is going through this journey, do help them. Any small gesture would make them feel happy.
वुमेन के लिए मेरे को लगता है जैसे ही कैंसर पता चलता होगा, पता चलता है कि कीमो होनी है, तो फर्स्ट थिंग दे
The
मस्ट बी
first thing is
थिंकिंग
lose your hair.
हेयर.
Yes,
What's your
yes. So I
that?
lost my hair during I think I started losing my hair during my second chemo. I had long hair, but because I belonged to a Sikh culture,
Yeah.
I somehow didn't wanted to let go my hair. And I
Mm.
was struggling with long hair, because when you start getting chemo, first thing you lose is your hair, then eyebrows, then eyelashes, everything,
Yeah,
the whole
right.
hair thing is gone. I used to have a lot of tangled hair. बहुत tangle हो जाते थे. I used to have a lot of headache. Doctors used to tell me over there, use
Hmm.
satin pillowcase. तो second chemo के बाद ना, when I used to have this headache, I went to see my oncologist about this thing, that I used to have a lot of headache and all. He's like, you need to let go your hair, Harjeet. And I was like, I can't. And he's like,
Hmm.
this will get worse. Trust me. You lose every hair in your body, but you need to let it go. You have to accept it. I went home, and my husband, he sat on a chair at the balcony and he shaved his head. And my dad was inside. I don't remember where was he. And then I came out, like, sit. Okay. And then he started shaving my head. And my dad could not see it. And my mom could not see it. They just left the room. And I had that bald head. And I saw myself. The first time I felt, what has happened? This is not me.
For girls, I think
Because for
hair
girls, I think the
apparel
hair is
an
something,
emotion.
emotion,
Yeah.
you feel that you're naked without hair.
Yeah. Absolutely
So
agree.
that
Yeah.
was the feeling. I didn't had hair, I felt like, there's nothing in my body anymore.
Mm.
That gives you that physical appearance is all
Parents,
because of your hair,
yeah. Hair.
right? So the next day I got up and I used to do a lot of FaceTime to my family back home, my grandparents. And my dad was like, cover your head and talk. Okay, fine. At that moment, I did all the things. I used to cover my head. I used to go out. I used to cover my head, because sometimes because I stay in a cold environment, I am okay to cover my head. But there
Yeah.
were times when it's hot. I can't sleep, while
Mm.
so at that moment I used to feel like why I have to cover my head. फिर थोड़े टाइम बाद I realized that they have to accept it. But वो acceptance बहुत बाद में आई for all of us. Like I felt कि they need, I have to accept it. I have to embrace this, and they have to accept that this is my new normal. So वो बहुत ही challenging था to let go my hair, to lose my hair, and I lost it twice. क्योंकि कीमोस के टाइम पे I lost. And थोड़े थोड़े छोटे 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 आने शुरू हो गए थे. I used to like touch it and I like अब तो बढ़ जाएंगे, and then stem cell happened. I lost it again.
Again.
So and it's not even growing back. जितने पहले थे उतने नहीं आते हैं. And after last year only I spoke to my oncologist and like why my hair are not growing. I've seen so many people. 4 साल हो गया, 5 साल हो गया. He's like it's because of your DNA. Your brother is your DNA now. So whatever cells and whatever things were happening, it's all you're not this is not your DNA. This is your brother's DNA. So that's also something very interesting to know that this is all my brother's given DNA. So
Yeah.
so but yeah, I've started embracing myself now like this. I miss my long hair. I style it with wigs and stuff, but I feel that's one thing which I feel it's very important for women. And there are a lot of organizations in India and outside now, they are providing wigs.
Yeah.
And I've collaborated with a couple of people who do provide wigs for cancer patients. And over there, the hospitals had free wigs for cancer patients, which I feel it should be very important in India too. Like I remember they had a salon, like in hospital, where girls used to go and get their head shaved, and then they used to give free wigs to them till the time they had chemo. So I borrowed wigs from them. So it's a nice thing that they have these kind of things over there. There's an organization called Look Good Feel Better. I'm a patient partner with them, and they teach how to do your eyebrows without having
Oh my God. I think
and
in India should come up with all these things.
yes, I think
Yeah.
that's very important because
Very important.
you like I never used to get ready and go to the chemo, but I've seen people getting ready and going for the chemos,
I think when
getting
you get
dressed.
ready, you yourself start feeling
Yes.
good
So
and you
at that
start
moment in the
embracing
beginning, I
yourself.
was never like that. But slowly, I used to like, obviously, I had pick line, port line. I used to have sweatshirts and, with zippers and
Yeah.
all. I had no idea. But now, after my diagnosis, when I see all those things, there are organizations who have actually, started making clothes for cancer patients so that they don't have to wear it from the top. It's a zipper. It's the support pick line. You can open it and get it.
Wow.
So there are makeups, the people who teach you what products to use, what not to use, how to do your eyebrows, what kind of wigs you should use, how to tie your hair, what bandanas you should use, how
Oh,
to
yes.
so all those things. So I've joined those things over there. So I feel that gave me that kind of sense, okay, I can look pretty too.
Yeah.
I
I think
can.
when you start doing something, small things
Yeah.
for yourself, you yourself start
Yeah.
feeling confident
Yeah.
and look pretty.
And I think if you look that way,
Yeah.
that gives you a different perspective.
Yes.
If you feel that, oh, you're sick, you don't want to do anything.
You'll start feeling even more
Yeah.
sick.
Yeah.
The same happens now when we are sitting, when we are lounging at home the whole day. We don't want to get up and
Yeah.
do anything. But once we get up, we are all energetic to do
Yeah.
more good
And there's one
things.
more thing called Nazar. So
Yeah.
I remember when I started posting my picture after after all this happened, I just wanted to share it publicly,
Yeah.
and I wanted to share my story publicly because I was very social before that. And then after 1.5 year, I was completely, I never wanted to take my pictures. I was like, don't take my pictures. And but through time baad, I wanted to embrace everything. And I remember I posted 1 or 2 pictures during my treatment, and my mom was like, अब तो ठीक होगी, अब नजर लग जाएगी. I was like,
इससे ज़्यादा और क्या
इससे
नज़र
ज़्यादा, that was the exact word I said. Like, इससे ज़्यादा और worse क्या हो सकता
क्या
है मेरी life
होगा?
में?
I मतलब
I mean,
totally
if with my
agree.
story, if someone is getting help, if someone is
Yeah.
getting that, empowerment or, that strength, why not?